Diarrhea is a common symptom of many gastrointestinal diseases and consists of the frequent emission of poorly formed and liquid stools during the day. Let's see better what it's about in today's video. Hello and welcome to Med4Care. Today's topic is diarrhea. This problem is the result of greater secretion of water by the intestine, quite evident in cases of osmotic diarrhea, supported by an underlying infectious process. It can present with an acute and time-limited episode, or with a chronic manifestation that tends to last for weeks or even months, and is often accompanied by nausea, vomiting and abdominal pain. It occurs mainly due to infections or toxins contained in foods, or, alternatively, it can arise in the context of non-infectious diseases, such as chronic inflammation of the intestine. It is certainly a very common symptom in the world, and it is estimated that more than 1 billion people have suffered from one or more episodes of diarrhea at least once in a year. The prevalence in Western countries is not well defined, although it is estimated to be between 3% and 20%. Unfortunately, in developing countries, infectious diarrhea remains one of the most frequent causes of mortality, especially in children under 5 years of age. This symptom can first of all be distinguished into acute diarrhea and chronic diarrhea. Acute diarrhea is defined as loose stools more than 3 times a day for less than 2 weeks. In various conditions, episodes of acute diarrhea are caused by the pathogenic action of a virus that penetrates the cells that make up the epithelium lining the intestinal mucosa. Chronic diarrhea. This is the persistence of the same symptom that lasts beyond 14 days. In cases where diarrhea tends to worsen or become chronic, factors that are not necessarily infectious, which have led the intestine to secrete a greater quantity of liquids, must also be taken into consideration. Based on the mechanism of onset, however, diarrhea is divided into the following categories. Non-inflammatory diarrhea, characterized by an alteration of the structure and functionality of the intestinal mucosa. The stool is very watery and does not contain leukocytes, and is often caused by intestinal infections. Inflammatory diarrhea, characterized by massive destruction of the intestinal mucosa and evident inflammatory infiltration. The feces are slightly more consistent and have streaks of mucus mixed with blood, as well as a high concentration of leukocytes. To overcome this annoying symptom, a specialist evaluation is necessary through a gastroenterological examination. The medical history plays a fundamental role as it can guide the doctor towards knowledge of certain factors, such as a patient's trip to exotic locations. It is necessary to talk about the characteristics of the stool past and the description of any associated intestinal symptoms, such as nausea, vomiting, fever and abdominal pain. Have we eaten potentially infected foods, such as raw or contaminated foods? Have we been exposed to swimming pool water, marine environments or campsites? For children, for example, exposure to nursery school where the proliferation of bacteria and viruses responsible for gastroenteritis is very frequent, is a determining factor. Exposure to domestic or stable animals and the use of chronic antibiotics must also be considered. Once the anamnesis phase is over, the doctor focuses on the objective examination of the patient, inspecting and palpating especially the abdominal region, looking for any signs of abdominal distension or pancreatic distress. Taking into account that most episodes of acute diarrhea tend to resolve spontaneously within a few days, the diagnostic evaluation of diarrhea must continue in cases of diarrhea that is persistent or aggravated by other factors. In these cases we continue with stool culture examination. Treatment of acute diarrhea generally involves the following steps. Initial rehydrating treatment. One of the most fearful complications of diarrhea, especially in pediatric patients, is dehydration. To overcome this problem, patients are given special oral solutions that contain water, salt and sugar in certain proportions, with the aim of achieving rapid rehydration. Empirical antibiotic therapy. Since the results of stool culture tests are not produced quickly, antibiotic therapy is often started on an empirical basis, which has the aim of counteracting, through broad-spectrum drugs, the action of the bacteria most commonly involved in the genesis of diarrhea. Specific anti-infective therapy. In the case of infectious diarrhea, once that specific bacterium, virus or parasite is isolated, a very specific and direct therapy is started. The most common complications of untreated diarrhea or diarrhea that occurs in a particularly severe form are dehydration and consequent malnutrition. Depending on the specific pathogenic strain that induces the appearance of diarrhea, more serious complications can occur such as meningitis, chronic diarrhea, hemorrhagic colitis, up to liver abscess and perforation of the colon. In conclusion, diarrhea is a very frequent symptom in the general population and which, most of the time, tends to be self-limiting and resolves over time. To prevent the onset of diarrhea, it may be important to carry out preventive actions such as cooking food, the consumption of strictly bottled water, avoid coming into contact with sources potentially contaminated by bacteria, viruses and protozoa, always respecting hygiene standards. We have now reached the end of today's video. We hope you liked it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video of ours comes out. See you soon on Med4Care.